The number of hantavirus cases linked to a cruise ship is mounting. A Spanish passenger is the latest to test positive, bringing the total confirmed cases to 7.
Yeah, Madrid's health ministry says the patient is not suffering symptoms. The Spaniard was among those evacuated from the MV Hondius off the Spanish island of Tenerife. Well, evacuations have wrapped up with more than 100 passengers and crew flying out, many to their home countries. Some 24 staff will remain on a Dutch-flagged ship sailing to the Netherlands, where the vessel will be disinfected.
But the outbreak has killed 3 people. The WHO, which oversaw the evacuations, is urging governments to enforce a 42-day quarantine for returning passengers and crew.
What I believe is all countries who have been involved take this very seriously, and they will do everything to help the passengers and to protect also the rest of their citizens.
Well, a report citing WHO information says the nationalities of the 7 confirmed cases are 2 British nationals, 1 French, a Dutch national, Spanish, Swiss, and American.
The U.S. Trump administration is defending its response to the outbreak. It's facing criticism for withdrawing from the WHO and questions over not making the 42-day quarantine mandatory.
We have this under control, and we're not worried about it.
But the CDC took 4 days after the WHO issued its alert. Why was it? Why did it take the U.S. 4 days to issue an alert?
It's not true. As soon as we determined that the virus was out there, we issued an alert. But the alert means nothing.
They acted very quickly. I saw the alert too. Give me a break. They acted very, very quickly, and it looks like, and can't bet anybody's life on it, but it looks like it's just a disease that we've had around in a very small way for a long time.
France taking no chances, putting 8 people in isolation in hospital after they were on a flight with an infected person. The French Prime Minister said on social media that the public health response is clear and there will be no exception. Quarantine will be reinforced in a hospital setting. Ross Cullen reporting for CNA has more about the confirmed case in France.
I'm here outside the Bichat Hospital. You can see it behind me. This is where the 5 French citizens who were flown back from Tenerife in the Canary Islands to Paris, this is where the 5 of them are being kept in isolation. This is also where the 1 French woman who has tested positive for the hantavirus, where she is being treated. The French health minister saying that she started to feel unwell on that flight to Paris, and her condition has deteriorated overnight, so she is being watched by doctors and the other patients who have been potentially close contacts. They are being kept in isolation. More than 20 other people elsewhere in France have been contacted by the French medical authorities to say that they are close contacts. Perhaps they were on the flight from Johannesburg to Amsterdam with other people who'd been on the cruise ship, so they're being urged to self-isolate.
Well, the cruise ship outbreak has put the spotlight on the family of hantaviruses.
Yeah, there is no cure or vaccine currently, but one global team of scientists is hoping to change that. And they're working on a possible new vaccine to tackle one of the strains. Hantaviruses are carried by rodents, and people usually get infected through contact with infected rodents, or their urine or droppings or their saliva.
But the research team from Britain's Bath University is working to develop a new mRNA vaccine against a Hantan strain of hantavirus. mRNA vaccines use genetic codes to trigger an immune response. But the team says the antigen worked very well in multiple animal models. Now, new technology called ensilication was used to add a layer to protect the vaccine when transporting in higher temperatures.
Yeah, the ship Hondius was not affected by the Hantan strain, but the Andes strain. The research team hopes its work could pave the way for something against the Andes.
We don't know whether the antigen which we have developed will be useful against Andes at the moment. We're hoping that it will be. But obviously, until we have actually tested against the Andes virus, we will not know.
For more on the expert's take, we have Catherine Bennett. She's a Deakin Distinguished Professor and Chair in Epidemiology at Deakin University. Professor Bennett, thank you very much for joining us. So this rise in number of hantavirus cases linked to the cruise ship, I mean, given the virus's relatively long incubation period, is this increase expected, or does it suggest a change in the risk level?
We saw the first cluster of cases on the ship appear between about 2.5 weeks and 3.5 weeks from that first, what we think is the index case, a gentleman who developed symptoms early in April, on the 6th of April, and passed away about 5 days later. So we then saw half a dozen people who were on the ship at the time he was unwell, then developed symptoms down the track. All but one of those were still on the ship. So then you have another potential source of infection for other people on the boat. They didn't know it was hantavirus. The first case really presented like a flu-like illness. It was only around the 2nd of May that they got the first test results back from other people who had been unwell that they identified hantavirus. So unfortunately, you have this sort of ongoing exposure when people develop symptoms, they're infectious around the time they first get those symptoms in particular, that then exposes other people. So it's a rolling process. We're probably now seeing potentially, with the latest cases reported from the people repatriated from the ship on the weekend, this might be the next chain of transmission. People who were exposed back then around the 24th, 28th of April, they might have been incubating the virus ever since then and now are becoming unwell.
When we look at the responses and measures in place so far, such as medical evacuations, contact tracing, tightening screening at airports and seaports, just how confident can we be that this cluster is still contained?
Well, they worked very hard. As soon as they knew this was hantavirus, particularly the Andes strain, they worked hard to try and trace all those close contacts. As you mentioned, that flight the woman took, who'd been on the boat, she was symptomatic when she travelled and then passed away in South Africa. All of the people on that flight would be then followed up as well. And there were a number of people who disembarked from the ship back in around 24th of April. So they will also have been followed up by now. I think there was potentially problems tracking all people and then tracking where they were. If they were still asymptomatic by the time they were found, even if they went on to become cases, they're not posing a great risk to other people. We don't know for sure. They don't know a lot about human-to-human transmission because it's not that common with this virus, but they think people are really infectious just in the lead-up, if at all, before symptoms, and then at the time they first develop fever and other symptoms. So I think that's somewhat reassuring that it's not like COVID. You can't see people spreading 2 or 3 days to a lot of people before they develop symptoms themselves. So it really gives contact tracers time to find people who might have been exposed, get them isolating. So even if they do themselves go on to develop disease and become infectious, they're not out and about when that happens. So that's what they'll be doing. I think all countries are taking this seriously, particularly those, including Singapore, bringing people home who were on that boat and then making sure that they're looked after, they're tested, and to both look after their health but also make sure that no one else is at risk.
Yeah, Professor, given there were multiple nationalities on that cruise, how important is coordinated response from countries in a situation like this? For example, the U.S. is opting for optional quarantine, but France, as we heard, is putting people in isolation, no exceptions, and is isolation in hospitals.
Well, that's right. I think the US were talking about that for people who might have already returned, people who now, if they were off the boat on the 24th of April, we know that was their last exposure. But the people, I think, who've come off the ship on the weekend will be going into isolation in the US as well. And I think that's the clear message. The guidance from WHO has been very clear about the risks here. I think the coordination from the WHO has been important, and coordinating countries under the international health regulations has been really helpful. That gave the ship somewhere safe to dock, and then the opportunity for countries to manage that repatriation back home under very safe circumstances, not putting people on commercial flights, getting them out safely, and respectfully as well. Managing those people's own anxiety is an important part of this response, but clearly the biocontainment, the careful attention to that risk of exposure to people in that process of transiting back home is something that that does really need to be managed carefully.
Professor, we are hearing reports of work by international teams to develop a vaccine using newer approaches like thermal stabilization. Just how promising is this effort in changing how hantavirus outbreaks are managed?
Look, I think that's the key here. They wouldn't be vaccination for the whole population. It would be really looking at situations, particularly the virus they're focusing on. The strain is one that is transmitted from usually wild rodents to humans. And so if you identify an outbreak where there's an incursion into a natural habitat of rodents carrying that virus, then being able to vaccinate the community at risk so that once you see a case or it's identified in the rodent population, that you're then able to protect those people who are in direct risk from that particular crossover. We don't know whether that vaccine targeting that particular strain would also work for Andes, but one would hope that there could be some cross protection, and it might be if not that vaccine, then another developed for this particular strain that would allow us to vaccinate people who very early after their exposure to help prevent them from going on to developing this awful disease. So that's the hope. It's great they've been doing some work on this already. That puts us a step ahead, but we're not quite there yet.
All right, Professor, reports from government medical officials are saying this is not like COVID. You also kind of alluded to that. But if you could just explain to us again why officials say that, the risk of a major outbreak is very low, and whether, can this virus, this strain, can it mutate, can it evolve, and then what happens?
This virus has been around for a while. Human-to-human transmission in local outbreaks for this Andes strain has been known before. This is not different. Usually it's seen amongst household members, for example. It's really close contacts. The ship provides that kind of environment for more people. They share a common dining room. The ship's doctor was treating the patient. He became unwell as well, that first patient was the one that we think brought the virus on board. So ships, even really well-managed ships, they still have common areas and shared airspace, and you're actually in touch with the same people in the same airspace day after day, and that's what puts them at a higher risk. So it doesn't mean this has shifted into something that would behave the same way if it was a hotel or somewhere else. It still takes quite direct human-to-human contact. The initial work the WHO did in identifying who those early cases and how they were connected supported that and suggested that it was close contact, sustained contact that put people at risk. So the ship is in some ways the worst scenario. That's the environment the virus will spread quite effectively, but it won't be as effective outside of that. So normal containment, wearing protective equipment, all of those things that the health workers will be doing who are working with the people who are either cases or at risk of it being incubating the virus at the moment, that will protect those people. We don't expect to see transmission. It's not airborne in the same way that COVID became, where someone who was at the other end of a large open area could still contract the virus. It takes much more direct contact in the case of the Andes strain.
Okay, Professor, thank you for clarifying that for us and your expertise this morning. Catherine Bennett, Deakin Distinguished Professor and Chair in Epidemiology at Deakin University. Thank you.